Large brown spots, age spots, develop on skin that has been exposed to sunlight, perhaps because the skin is less able to remove waste products. The skin is less able to form vitamin D when it is exposed to sunlight. Thus, the risk of vitamin D deficiency increases. Brain and nervous system. See also effects of aging on the nervous system. The number of nerve cells in the brain typically decreases. However, the brain can partly compensate for this loss in several ways. As cells are lost, new connections are made between the remaining nerve cells. New nerve cells may form in some areas of the brain, even during older age. The brain has more cells than it needs to do most activities, a characteristic called redundancy. That is, more than one area can perform the same function. Thus, areas with somewhat overlapping functions can sometimes compensate for lost functions. Levels of the chemical substances involved in sending messages in the brain tend to decrease, but some increase. Nerve cells may lose some of their receptors for these chemical messages. Blood flow to the brain decreases. Because of these age-related changes, the brain may function slightly less well. Older adults may react and do tasks somewhat more slowly, but given time, they do these things accurately. Some mental functions, such as vocabulary, short-term memory, the ability to learn new material, and the ability to recall words, may be subtly reduced after age 70. After about age 60, the number of cells in the spinal cord begins to decrease. Usually, this change does not affect strength or sensation. The brain has ways to compensate for the loss of nerve cells that occurs with aging. As people age, nerves may conduct signals more slowly. Usually, this change is so minimal that people do not notice it. Also, nerves may repair themselves more slowly and incompletely. Therefore, in older adults with damaged nerves, sensation and strength may be decreased. Heart and blood vessels. See also effects of aging on the heart and blood vessels. The heart and blood vessels become stiffer. The heart fills with blood more slowly. The stiffer arteries are less able to expand when more blood is pumped through them. Thus, blood pressure tends to increase. Also, the heart does not respond as quickly or as well to chemical messengers that normally stimulate it to speed up. Despite these changes, a normal older heart functions well. Differences between young and old hearts become apparent only when the heart has to work hard and pump more blood. For example, during exercise or an illness. An older heart cannot speed up as quickly or pump as fast or as much blood as a younger heart. Thus, older athletes are not able to perform as well as younger athletes. However, regular aerobic exercise can improve athletic performance in older adults. See exercise in older adults. Age-related changes in the heart and blood vessels are among the changes most responsive to lifestyle habits, such as exercise, sleep, and diet. And, when needed, medications. Lungs and the muscles of breathing. See also effects of aging on the respiratory system. The muscles used in breathing, the diaphragm and muscles between the ribs, tend to weaken with age. The number of air sacs, alveoli, and capillaries in the lungs decreases. Thus, slightly less oxygen is absorbed from air that is breathed in. The lungs become less elastic. In people who do not smoke or have a lung disorder, these changes do not affect ordinary daily activities. But if pneumonia develops, these changes may make breathing and exercising more difficult. Breathing at high altitudes, where there is less oxygen, may also be harder. The lungs become less able to fight infection, partly because the cells that sweep debris containing microorganisms out of the airways are less able to do so. Cough, which also helps clear the lungs, tends to be weaker. Digestive system. See also effects of aging on the digestive system. Overall, the digestive system is less affected by aging than most other parts of the body. The muscles of the esophagus contract less forcefully, but movement of food through the esophagus is not affected. Food is emptied from the stomach slightly more slowly, and the stomach cannot hold as much food because it is less elastic. But in most people, these changes are too slight to be noticed. Certain changes cause problems in some people. The digestive tract may produce less lactose, an enzyme the body needs to digest milk and dairy products. As a result, older adults are more likely to develop intolerance of dairy products. Certain changes cause problems in some people. the digestive tract may produce less lactose, an enzyme the body needs to digest milk and dairy products. As a result, older adults are more likely to develop intolerance of dairy products, lactose intolerance. People with lactose intolerance may feel bloated or have gas or diarrhea after they consume dairy products. In the large intestine, materials move through a little more slowly. In some people, this slowing contributes to constipation. The liver tends to become smaller because the number of cells decreases. Less blood flows through it, and liver enzymes that help the body process medications and other substances work less efficiently. As a result, the liver may be slightly less able to help remove medications and other substances from the body. And the effects of medications, intended and unintended, last longer. Kidneys and urinary tract. See also effects of aging on the urinary tract. The kidneys tend to become smaller because the number of cells decreases. Less blood flows through the kidneys, and at about age 30, they begin to filter blood less well. As years pass, they may remove waste products from the blood less well. They may excrete too much water and too little salt, making dehydration more likely. Nonetheless, they almost always function well enough to meet the body's needs. Certain changes in the urinary tract may make controlling urination more difficult. The maximum volume of urine that the bladder can hold decreases. Thus, older adults may need to urinate more often. The bladder muscles may contract unpredictably, become overactive, regardless of whether people need to urinate. The bladder muscles weaken. As a result, they cannot empty the bladder as well, and more urine is left in the bladder after urination. The muscle that controls the passage of urine out of the body, urinary sphincter, is less able to close tightly and prevent leakage. Thus, older adults have more difficulty postponing urination. These changes are one reason that urinary incontinence, uncontrollable loss of urine, becomes more common as people age. In women, the urethra, the tube through which urine leaves the body, shortens, and its lining becomes thinner. The decrease in the estrogen level that occurs with menopause may contribute to this and other changes in the urinary tract. As men age, the prostate gland tends to enlarge, a condition called benign prostatic hyperplasia. In many men, the prostate enlarges enough to interfere with the passage of urine and to prevent the bladder from emptying completely. As a result, older men tend to urinate with less force, to take longer to start the stream of urine, to dribble urine at the end of the stream, and to urinate more often, including waking up more often to urinate during sleep. Older men are also more likely to be unable to urinate despite having a full bladder, called urinary retention. This disorder requires immediate medical attention. Reproductive organs. See also effects of aging on the female reproductive system. The effects of aging on sex hormone levels are more obvious in women than in men. In women, most of these effects are related to menopause, when the levels of female hormones, particularly estrogen, decrease dramatically, menstrual periods end permanently, and pregnancy is no longer possible. The decrease in female hormone levels causes the ovaries and uterus to shrink. The tissues of the vagina become thinner, drier, and less elastic, a condition called vulvovaginal atrophy. In severe cases, these changes can lead to itching, bleeding, pain during intercourse, and a need to urinate immediately, urinary urgency. The breasts become less firm and more fibrous, and they tend to sag. These changes make finding lumps in the breasts more difficult. Because the breasts change with aging, finding lumps that could be cancer may be harder. Some of the changes that begin at menopause, such as lower hormone levels and vaginal dryness, may interfere with sexual activity. See Overview of sexual function and dysfunction in women. However, for most women, aging does not greatly detract from enjoyment of sexual activity. Not having to worry about becoming pregnant may enhance sexual activity and enjoyment. See also effects of aging on the male reproductive system. In men, changes in sex hormone levels are less sudden. Levels of the male hormone testosterone decrease, resulting in fewer sperm and a decreased sex drive, libido, but the decrease is gradual. Although blood flow to the penis tends to decrease, most men can have erections and orgasms throughout life. However, erections may not last as long, may be slightly less rigid, or may require more stimulation to maintain. A second erection may require more time. Erectile dysfunction, impotence, becomes more common as men age and is often due to a disorder, usually a disorder that affects blood vessels, such as a vascular disease, or diabetes. Endocrine system. See also effects of aging on the endocrine system. The levels and activity of some hormones, produced by endocrine glands, decrease. Growth hormone levels decrease, leading to decreased muscle mass. Aldosterone levels decrease, making dehydration more likely. This hormone signals the body to retain salt, and therefore water. Insulin, which helps control the sugar, glucose level in blood, is less effective, and less insulin may be produced. Insulin enables sugar to move from the blood into cells, where it can be converted to energy. The changes in insulin mean that the sugar level increases more after a large meal and takes longer to return to normal. For most people, the changes in the endocrine system have no noticeable effect on overall health. But in some, the changes may increase the risk of health problems. For example, the changes in insulin increase the risk of type 2 diabetes. Thus, exercise and diet, which can enhance insulin's action, become more important as people age. Blood production, the amount of active bone marrow, where blood cells are produced, decreases. Therefore, fewer blood cells are produced. Nonetheless, the bone marrow can usually produce enough blood cells throughout life. Problems may occur when the need for blood cells is greatly increased. For example, when anemia or an infection develops or bleeding occurs. In such cases, bone marrow is less able to increase its production of blood cells in response to the body's needs. Immune system. The cells of the immune system act more slowly. These cells identify and destroy foreign substances, such as bacteria, other infecting microbes, and probably cancer cells. This immune slowdown may partly explain several findings associated with aging. Cancer is more common among older adults. Vaccines tend to be less protective in older adults, but influenza, pneumonia, and shingles vaccines are essential and offer some protection. As people age, the immune system becomes less effective, and other disorders are often more common among and more severe in older adults. Thus, older adults are more susceptible to illness and death caused by infections that could be prevented by vaccines, and getting vaccines becomes increasingly important for them. Some infections, such as pneumonia and influenza, are more common among older adults and result in death more often. Allergy symptoms may become less severe. As the immune system slows down, autoimmune disorders become less common. Older adults are more susceptible to illness and death caused by infections that could be prevented by vaccines, so getting vaccines becomes increasingly important for them.